Now, moving on to past medical history. So here, when was your last medical period? Did you have regular periods? Just two questions, move on. Is this your first child? If they say, no, this is not my first child, then you need to ask, okay, what about your last child? And how was the last child delivered? Now, where does this become important? Of course, if this patient had a first child who was delivered by a C-section, then you know that you need to spend some time talking about when was that child delivered, how long has it been now, that they have conceived, what is the age gap between the first child and the second child. You do want to know, what if the first child is just 6 months old and now this patient is in her first trimester, right? So you have to note all, you have to document those things, you have to note all those things, because this in itself can be a scenario. That is, who has heard of VBAC? Anybody has heard of VBAC? Obstetricians on the session, or people who are working in the gynecology department. Yes, what does VBAC stand for? Yes, very good, Dr. Divya. So this is the reason why I have included this point here. Okay, sometimes what can happen is there's no history in the first trimester. There's nothing. This patient is completely fine. They do not have any complaints, but they're still here. They're talking to you, and you're wondering why. So here will come the part where you will know, okay, my scenario is about this. So this is the reason why this complaint I have elaborated, or I have um, specified this in the presentation today. Okay, moving on to that, if this patient does say, yes, I have two children before this pregnancy, then please do ask individually mode of delivery of each child. Spend some time when a scenario is new. Okay, spend some time to dig out and to find out why this is happening. Do not panic and think, I need to give the management for this, otherwise that's it, I'm going to fail this exam. Do not think those kind of things. Try to demonstrate that I am quite capable of thinking well under pressure. Okay, now moving on. The other important stuff in medical past medical history is coexisting medical conditions. Please do not miss out hypertension, diabetes mellitus, and previous or before the pregnancy if this patient was diagnosed with asthma. Okay, these three conditions are very important because management in pregnancy can be a little complicated or different, may require a lot of appointments, input of specialists and all those things. So you do want to keep in mind that I do want to ask at least these three questions before I move on to the next set of questions. Okay, is everybody okay with this? Shall we move on to the next part? Okay, great. All right. So moving on. Medications. Now, very often I find that the candidates ask me once again, are you taking any medications? Okay, so if you ask this patient, are you taking any medications, they will say, no, I'm not taking any medications. Then when you come to the management and you tell them that, okay, we are going to give you this treatment, that's the time they will say, oh, but doctor, I'm taking oral steroids for my asthma. Do you think that's going to affect my baby in some way? So you will be in for a shock. So please do not do that. Once again, please correct your notes and write any long-term medications that you have been taking. Apart from that, any over-the-counter drugs or any supplements. Now, depending on which trimester you are dealing with, folic acid, iron tablets, vitamin D, vitamin A, all these you can ask. However, if this is not the first child, please do ask the mother if any iron tablets were taken in the previous pregnancies. All right. Allergy also comes under past medical history itself. It does not come in P3. So over here, when you ask about allergies, please be very specific. Once again, allergy to any medications, any foods. Have you ever experienced any previous reactions to any medications? Okay, so these are also some things which are very important to take note of. How do you condense this? Once again, please, if you have this question running in your mind that, okay, this is quite a lot to ask in the history, so how do we condense this for our scenarios? So when we discuss those scenarios one by one, we will discuss the art of focused history taking. Okay, we won't do this right now, not in this session, not for today. And those sessions, the practice sessions for specific scenarios, let me tell you once again, those will not be recorded, those will not be put up on YouTube. Those are just practice scenarios for you and me. That's it, nothing else. Okay, moving on. 2. Personal medical history, which includes lifestyle, which is my P3 component. Okay, so I want to ask this patient about their diet, exercise and physical activity, use of substances like smoking, alcohol and illicit drugs, sexual activity and travel. All of these comes under personal or lifestyle history. Now, there is one question I want to ask over here. If you have a scenario which deals with a patient coming in for, a first trimester assessment. Okay, you are an FY2 in the antenatal clinic, so this patient has come for you, so you want to know that what are we going to tell this patient. So can someone tell me what is the importance of physical activity and exercise when a patient is pregnant? Do you think it is wise to advise someone to take lots of rest? Because I did have this advice from someone who was practicing with me, and they said that because you have congratulations on being diagnosed with on being pregnant with your first child, it is advisable that you take rest. Do you think it's the correct advice to give? What is your opinion? What do you think? Yes, very good, very good. Thank you so much. I'm so happy to see this response. Yes, pregnancy on its own causes increased it it on its own increases the risk of coagulation. So it is very, very important for patients to be active and mobile. So please do not advise rest unless and until there is something like threatened abortion. Very good point, Dr. Shazia. So unless and until there is this risk of a threatened abortion, or if this patient has met with an accident or something like that, something which is a red flag, then you can give the advice of rest. Otherwise, you have to encourage these patients to be as active and as mobile as possible. Okay, so this is one important point which I want to tell you. Please, in your advices, do not say things like that. Okay, now, usage of substances like smoking, alcohol and illicit drugs. Now, I'm aware of the fact that there are two schools of thought regarding this. The first school of thought is that if my patient is smoking, if my patient is drinking alcohol, and my patient is using illicit drugs, I want to stop right here and counsel my patients regarding do not smoke, do not drink alcohol, and do not take illicit drugs. Okay, some people, they want to stop in the history itself and they want to counsel this patient because they feel that I may forget when I'm in the management. The second school of thought is that you finish taking all of the history and then in the management you address it. Okay, so this is the second school of thought. So there are two schools of thought. Now, how do you know that which one should I follow? So I get this question very often. What you should do is take your practice partner or take your mocks trainer, practice both the situations. So if you have one scenario, where a patient is abusing all of these substances or misusing all of these substances, to be honest, and you have another scenario on that same day itself with your mock trainer or with your practice partner, where this a patient is misusing these three substances. So for one scenario, you try to stop then and there and counsel this patient. For the next scenario, talk about it in the management and see which one looks better for you. So if you feel satisfied that, okay, when I did this, when I followed the first school of thought that I should stop then and there and counsel this patient, I felt that my performance is better and that my confidence and my presentation is very good, then that is something that works for you. If you feel that, no, when I stopped and when I counseled this patient, I did not do a good job and the rest of my management suffered because of this, then the first school of thought is not for you. So move on to the next school of thought. So the next school of thought is that you take all of the history and then in management you talk about it. So if you think that made your management extremely brilliant, that improved your scores, that gave you a satisfaction that, okay, this is something that, really improved my confidence for my performance, so then stick with that. Okay, so there's no need for you to feel pressurized that what should I do, because there are two schools of thought, what should I do, which is the right one. Please do not feel pressurized about it. Both of them are correct. It's up to you which one you want to choose. If you feel that this is something I need to address right now because otherwise my time will be up and I will have missed this really important point, then it's okay. You go ahead and do it. If you think that no, with this, there's probably something else that I'm missing and I want to take a history of that and then counsel this patient, you can do that also. You are allowed to do that. Nobody is going to penalize you for that fact. But what is important is you practice this beforehand and know that this is something that works for me and this is something that doesn't work for me. Okay, so this is my tip for this particular concern. Okay, now moving on. Okay, shall we move on? Okay, great. All right. Moving on. Examination. So, examination in the first trimester includes BMI, blood pressure. Second trimester, BMI, blood pressure, general physical exam, obstetric exam, auscultation. Third trimester, BP, BMI, general physical exam, obstetric examination, auscultation. So, should I mention examination in each and every scenario? Yes, you should. You do want to know the patient's BMI and you do want to know this patient's blood pressure, especially in the first trimester. Please do not miss those things out. Okay. So you do want to do all these things. So you have to verbalize them. Okay. So this is about examination. We will be checking when you talk about obstetric examination, you have to say specifically that we will be checking your tummy for the baby and for you, for both of you. Okay. So you have to say what do you mean when you talk about obstetric examination. Just simply going there and saying we will check your tummy, I do not advise that. Please give specific examination. It looks really nice. It's very melodious to hear, when somebody is so vigilant about what they are talking. So please do talk what you would like to examine. We would also like to hear your heart sounds, the baby's heart sounds. So this is what I mean when I say auscultation. Okay. So these are the things about examination. Moving on. Is everybody okay? Shall I move on?